The impact of climate change on public health and healthcare systems. Climate change is one of the most pressing issues facing our planet today. Rising global temperatures, changing weather patterns, and extreme weather events are having a profound impact on human health, with implications for healthcare systems and public health around the world. In this essay, we will examine the impact of climate change on public health and healthcare systems, and discuss potential solutions to address this growing crisis. One of the most immediate impacts of climate change on public health is the increase in extreme weather events. Heat waves, droughts, and floods can have a direct impact on human health, increasing the risk of heat stroke, dehydration, and waterborne illnesses. Extreme weather events can also damage infrastructure, disrupt supply chains, and limit access to essential medical care, particularly in low-income countries. Another significant impact of climate change on public health is the increase in air pollution. As temperatures rise, air quality is expected to deteriorate, particularly in urban areas. Exposure to air pollution can lead to a range of health problems, including respiratory illnesses, heart disease, and stroke. In addition, air pollution can exacerbate existing health conditions, such as asthma, making it more difficult for patients to manage their symptoms. Climate change is also expected to have a significant impact on the spread of infectious diseases. As temperatures rise, disease-carrying insects such as mosquitoes and ticks are able to expand their ranges, increasing the risk of diseases such as malaria, dengue fever, and Lyme disease. In addition, changing weather patterns can alter the distribution of diseases carried by animals, such as hantavirus and West Nile virus, making it more difficult to predict and control outbreaks. The impact of climate change on healthcare systems is also a growing concern. Extreme weather events can damage healthcare facilities, disrupt supply chains, and limit access to essential medical care, particularly in low-income countries. In addition, healthcare systems may be overwhelmed by the increased demand for medical care during and after extreme weather events, particularly for vulnerable populations such as the elderly and those with pre-existing health conditions. To address these challenges, healthcare systems will need to adapt to the changing climate by building more resilient infrastructure, improving emergency preparedness, and investing in preventive measures. For example, healthcare facilities can install backup power systems to ensure that essential medical care can continue during power outages. Healthcare systems can also invest in early warning systems and emergency response plans to better prepare for extreme weather events and other climate-related emergencies. Preventive measures can also play an important role in addressing the impact of climate change on public health. This includes initiatives to reduce greenhouse gas emissions and promote sustainable lifestyles, such as reducing reliance on fossil fuels, promoting public transportation, and encouraging the adoption of energy-efficient technologies. In addition, healthcare providers can work with public health officials and community organizations to promote awareness of the health impacts of climate change, and to develop strategies to reduce the risk of climate-related health problems. In conclusion, climate change is having a profound impact on public health and healthcare systems around the world. Rising temperatures, extreme weather events, and changing weather patterns are leading to an increase in air pollution, the spread of infectious diseases, and the disruption of healthcare systems. To address these challenges, healthcare systems will need to adapt to the changing climate by building more resilient infrastructure, improving emergency preparedness, and investing in preventive measures. By taking action to address the impact of climate change on public health, we can help to protect the health and well-being of communities around the world.